It sounds like a pig rooting, or a dog barking, or an elephant trumpeting. Not very flattering comparisons. But then, the person who often describes your snoring is the same person who was kept up all night because of it. I don't think they're going to think of it kindly. Don't let it bruise your ego. As many as half of adults snore sometimes.
When people sleep, their breathing changes. Everybody's breathing changes a little bit, but some people have almost an exaggerated response to sleeping, and the airway can actually narrow on itself, and your body not liking you not breathe, you snore the airway back open. So the sound that you hear, even though it sounds like it's really coming from the nose, is actually coming from the back of the throat, that it's the body trying to reopen the airway so that way breathing can restart during the night.
There are many causes of snoring, but it all comes down to the same thing: obstruction.
It's a combination of anatomy and physiology. Some people just have crowded airways, meaning that their soft palate comes really kind of low in the back of their throat and their tongue comes high. So when you look in the back of somebody's throat, there's no room back there. There's also a physiologic portion. Some people just have weakness in the back of their airway, and we don't really exactly know why it is. Sleep is kind of subjective, and it kind of changes during people's lives and during different stages of sleep. And some people just have a natural predisposition to the airway getting a little bit floppy on itself. It gets worse when you get older. It gets worse when you get heavier. So those are kind of the predisposing signs: crowded airway, being overweight, and unfortunately, as you get older, there tends to be more of a fragile nature of sleep in terms of breathing.
If someone is snoring regularly, they should see an otolaryngologist for a complete examination of the nose and the throat.
Snoring by itself is not a concern. Snoring ends up being more of a concern for the people that are sleeping with the snorers than with the snorers themselves. The reason why we care about snoring itself is that it may be a sign of something more serious like sleep apnea. So in addition to snoring, being really tired during the day is another sign of sleep apnea. And it's actually usually what brings patients in to see me. People snore forever, and nobody snores on a Monday and comes to see me on Thursday. It doesn't ever happen that way. People have been snoring for years, and then something usually changes. And what usually changes is that they start getting more tired during the day. Their work becomes affected. Their schoolwork becomes affected. They need to take naps in the middle of the day. That's what usually prompts people coming to see me, to see if it's more than just snoring, if there's really sleep apnea going on underneath as well.
Sleep apnea is considered a serious medical condition because it is linked to cardiovascular problems like hypertension, arrhythmias, and increased risk of coronary artery disease, heart attack, and stroke. Even if you have plain old snoring, it may result in daytime sleepiness, difficulty concentrating, and increased irritation and anger. If you want to get a good night's sleep and a healthy daytime, treatment is available.
There are a variety of things that are just specific for snoring. Some people's snoring comes just from nasal congestion, so sometimes using nasal steroids or nasal sprays, and those are now available over the counter. So they take down some of the swelling in the nasal passages to reduce the interruption of flow of air. So nasal sprays are one. They make things called breathe right strips that are little strips that you can put over the nose, and it kind of pulls the nasal passages open. That helps snoring. Weight loss helps snoring. Not using sedatives, which include alcohol prior to sleep, helps snoring by itself. Dentists are also getting into the snoring business, and they will make mouthpieces for snorers. The idea behind that is that if you make a mouthpiece that fits into the mouth, specifically fit for you, and it moves the lower jaw forward. So it moves the back of the airway away from the tongue and opens up that air passage and reduces the vibrations, which is really what's causing the snoring.
Then, you'll find a happy, rested face lying next to you when you wake up in the morning and when you look in the mirror. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.